NIH 2021. And it's a great pleasure for me to introduce our speaker today, Dr. Ngan, who is going to talk about the application of multiple criteria decision analysis, or MDCA, in health systems decision making. How are you, Doctor?
Yes, I'm good.
Yeah, good. Is it your first time in YouTube channel?
Yes.
Yeah, this is my second time actually. So both of us quite new with the YouTube channel. So right now we stream in NIH YouTube channel. So before I give the floor to you, I would like to just give a brief introduction about you. So Dr. Ngan is a senior lecturer at UKM Graduate School of Business. She received her Bachelor of Science with major in Actuarial Science and minor in Mathematics from University of Nebraska, Lincoln, USA. So she then received her doctorate degree from University of Nottingham, Malaysia, and her research interest lies in the areas of risk assessment and management, supply chain management, and sustainable development. And her works has been published in high-impact scientific journals such as Renewable and Sustainable Energy Reviews, Journals of Cleaner Production, and etc. And yeah, and to all the viewers of NIH YouTube channel right now, so if you have any question for our beautiful speaker this afternoon, so you can write it down in our chat box and I will read it to you. Don't worry. And without further ado, I would like to invite Dr. Ngan to start her talk. Dr. Ngan, the floor is yours.
Thank you very much for the moderator. So let me start sharing my screen. Can everyone see the script, the slides now? Yeah. So thank you very much for the NIH for the invitations for me to talk about the applications of multiple criteria decisions analytics in health system decision making. So as introduced by the moderator just now, so I'm from UKM Graduate School of Business. So most of my classes are connected to MBA students. And my research areas recently focus more on like enabling businesses or corporations to transitions to green economy, circular economy, as well as risk assessment and management. And MCDAs is one of the tools that I usually use or often use in my research as well. So without further ado, we will just move into the content for us today. So these are the brief outlines of what we will be talking today. So we will start with a brief introductions about decision-making process, and then we will jump into the two multiple criteria decisions analytics tools that I will be introduced today, which is analytics hierarchy process, as well as analytics networks process. And then from there, we'll move to conclusions. And then when I explain how to use the different NCDAs, then I will supplement with the examples in healthcare system as well. So we all know that the advancements of information technologies expose us to a lot of information. And when we have a lot of information, so that exposes us to a lot more complex decision as well. And in each of the decisions and in our minds, we does have factors or criteria on what we need to consider to help us to make that particular decision. And in most of the cases, if the decisions only concern ourselves, we would not list out all the factors that is essential to that decisions and then compare the significance of each of the alternative. So, and we have been observed repeatedly in research studies, people does provide subjective judgment based on their feelings, their intuitions, as well as their logical understanding in the decisions that they make. So in the past, most of the decision making, they are single criterion oriented with cost minimization. So for example, if you want to produce something, if you want to buy something, you think about you want to buy the cheapest, or you want to buy something that is most efficient. But with increasing awareness on sustainability, on the environmental impact on social well-being, So there are a lot more considerations that we need to take in nowadays. That is why MCDAs can step in to help us to make effective decisions to satisfy all the relevance criteria at various levels. So this is just a general step of a decision-making process. So when we want to make a decision, so what we need to do first is we need to identify what decisions we want to make, whether we want to buy a car, we want to choose the schools to attend, we want to buy equipment for the hospitals and so on. So we need to identify the decision. And then following with that, then we gather information, identifies what are the alternatives out there, how many different models are there, what are the price. So identifies alternative. And then from there, we weigh the evidence. And lastly, we make the decision. So we choose amongst the alternatives that we have. And when the resources are limited and the decisions that we make does have consequences on the interests of others as well, like especially decisions associated with healthcare system, that whatever decisions is conveyed, it affects the public as well. So we hope that the decisions process itself is guided through a systematic and transparent process, and which take in considerations of available data, as well as some of the qualitative variables such as the experience, the expertise in the decisions that we make. So MCDAs, it is a sub-disciplines of an operational research. So based on the definition, it is actually a study of methods and procedure by which concerns about multiple completing criteria can be formally incorporated into a management planning process. So regardless the decisions that you want to make as individual decision making, in which is only involve one particular specialist to choose make that decision, or that involve a group decisions making. So a certain numbers of specialists or departments considered weightage of each individuals and then coming out with the final decisions. And CDAs can help us in comparing all the conflicting or intercorrelated variables to reach to our final outcome. So MCDAs can be divided into two different categories. One is what we call as multiple attributes decision making, in which you already have a predetermined set of alternatives. So that is what we call as MADM. And multiple objective decision making, that is the decision in which naturally involves several competing objectives that requires to optimize simultaneously. I think a lot of the problems or issues that we face in our daily life is more like multiple objectives in which we have different constraints, and it only needs to compare and tries to come with the optimized solution. So the decision maker then, with the help of MCDA, they can select, they can prioritize, and rank a finite numbers of course of actions. So the first MCDA's methods that I will be introducing is what we call as an analytic hierarchy process. So analytic hierarchy process, it is first introduced by Thomas Sotty in 1977. He is a professor in mathematics. So both AHP and NMPs, in which I will be introducing later on, they are all both introduced by Thomas. So it is a comprehensive framework to cope with the intuitive, the rationals, and the irrationals at times. Because when human, we make decisions, sometimes consciously, unconsciously, we cannot assure whatever's come into our mind in our thought process is systematic, or it is good for that particular decision. So this method integrates the perspectives and the purpose in overall synthesis. So these are the breakdowns of the state for AHP. So it helps, the first, it always goes to when we have the goal, we have the questions that we want to solve. So it breaks down the problem into a smaller part. And then from a very smaller part, And then we can illustrate the relationship of all the different elements or criteria surrounded by that problems itself. And then we will call for a simple pairwise comparison judgment. This is all that we do for AHP. And then from there, we will move on to calculation. So you derive the priorities in each of the hierarchy. So it is a very powerful tool to aid decisions making, which involve multiples and conflicting objectives on criteria, especially sometimes when a lot of decisions that we make is associated with a quantitative and quantitative variables as well. Some of them quantitative, in which you can find data to support that particular decision, but some of them are qualitative, in which we can't have that. But AHP enables you to combine both of them, compare them in the same ground, and then you reduce the complex decisions through a simple pairwise comparisons questions only. So AHP and AMP, as I said just now, it is nothing new. It has been widely used in a lot of different arenas in different industries to making choices to prioritize or evaluate particular process, evaluate particular program, resource allocation, benchmarking, quality management, public policies, healthcare, as well as strategic planning. So in business corporations, a lot of time they do use AHP or AMPs to enhance their decisions making process as well. So these are the general steps for AHP. So if we go through here, you can see that it's actually covers the decisions making process in which I first introduced just now. So in the hierarchy model development itself, and then basically we frame the question itself, and then we collect data, identifies the criteria as well as the alternative out there. So all of them will be represented or illustrates in the hierarchy models itself. And then from there, we move on to a pairwise comparison judgment. If you are conducting a research, this is where the data collections part will come in. You develop your pairwise comparisons questions there, and then you collect your data, collect the judgment. And then from there, we will go into derive the priority weights, the calculation portion. And then consistency analysis. Later on, I will explain why do we need to do this. And then the last one, the final outcome is, it doesn't only give you the ranking or based on like you have 3 alternatives. It doesn't only tell you which one you should choose. The valuable thing for AHP is it's actually showing you the weights as well. So how many percentage alternative 1 is more preferred as compared to alternative 2 and alternative 3. So if you have 10 or more than 10 alternatives, you can do them. So it gives you the ranking and it gives you the weights of each of them as well. So we will look in deeper into the hierarchy models development as well. So what we do in these stages is basically we break down a complex and structured problem so into its components part. So what are the issue is, so what are you trying to attain by making this particular decision? And then what are the criteria associated with this decision? And what are the choices that you are having? Whether multiple alternative or whether you want to rank something. So all this, you are trying to collect data to help you to draft up your hierarchy models. And then from there, it gives you the overall view of the relationship. So which are the variables are criteria to this decision, which the variables are the alternative. So by looking at the hierarchy models itself, it gives you a very clear indications on what you want to achieve, what are the criteria associated with this decision, and what are the choices that you have. So in most of the cases, we usually frame our hierarchy models based on this. The first levels is the objective, the focus concern with the best choice. And in the second levels are all the criteria considered. And in our third levels is our alternative. So this is an example. So for examples today in which we want to buy medical glove, or if the hospitals that collect, they receive multiple tenders from different companies or medical grade, but you are not sure which selections you choose. So we can frame that simple questions into a hierarchy models as shows here. So what our end goal is, we want to buy a medical glove, okay? And what are the criteria surrounded by that decision? So probably first thing we look at the price, whether how prices and different alternatives are. So wants to look into the price. And we also want to look into the resilience and the strengths for that particular brand of the glove. When doctors and nurses, when you are performing different tests, you want to make sure that the glove doesn't tear or split easily, or whether it does protect from the cross infections and so on. So that is one of the criteria we are looking into. And the third criteria that we included in these examples is the feelings and sensitivities. So when medical tests requires to handle instruments, you probably want to be able to feel the wind or something. So these are the three criteria. So when you have the criteria, so you can form them into a hierarchy models as such. So with the goal in the first levels, your second levels, all the criteria involved, and all your alternative, all the different brands or all the different tenders that you're receiving, so A, B, C, D, so they are all in your third levels. So from once you are done with your hierarchy model developments, I would say you are completing like about 30%. So that is the most crucial parts to collect sufficient information for you to plot them into a model. And then from there, you call for pairwise comparison judgment. So it's a very simple pairwise comparison judgment. Basically is if the decision itself is associated with three criteria. So what you need to do is you basically just compare all the criteria in pair based on the dominance relationship. So you line them up, A and B and C, and then for all that the decisions that they need to make when they respond to this pairwise comparison, they just compare them in pair, and then they tell you either A is more important or more preferred as compared to B, or B is more preferred to A. So this is how the data collections will look like. So for EHP, we are using SOTI's 9-point fundamental skills. So the numbers of the questions, so depending on how big your hierarchy models is, so that tell you how many numbers of pairwise comparison questions that you have. So this is the formula. N is the numbers of elements in that particular levels. So for example, just now we have 3 criteria. Okay, so a total number of questions is 3. Multiply with 3 minus 1 equals to 2. So 3 multiplies with 2 equals to 6. And then you divide it with 2. So 3 questions. So if you have, for example, you have 5 elements, criteria that you are looking into. So how many pairwise comparisons questions you will have? 5 multiplied with 4, 20, divided by 2, then you will have 10 questions. So that is how you calculate how many questions there will be. And then for all your questions, you can formulate them based on different dominance relationship. So it can be based on importance, it can be based on preference, it can be based on likelihood, how likely is the particular event will happen, or it can be based on influence, like whether A have more high power of influence on others, or B have higher power of influence. So these are the dominance relationship. So these are the tables on your right-hand side, that is the skills and the descriptions of the SOTI 9 points fundamental skill, in which when we choose one, that means the dominance relationship are equal. So if the dominance relationship we look into is important, then if I select one, that means they are equally important, and vice versa. So if we plug it into the examples, the hierarchy models that we showed just now in buying a glove, So how you can formulate your questions, you probably can ask which criteria so it's more important in choosing medical glove. So you can see from here, your dominance relationship is important. So which one is more important? And then how you answer the questions, price, resilience, and strength. So if you are the one who makes the decision, how you can just rank it. So for example, if I choose three closest to the resilience and strength, how do I interpret these particular values is resilience and strength is moderately more important. 3 is moderately, so it's moderately more important as compared to price. So if I compare price and feeling and sensitivity, so if I choose 7, that means price is very strongly more important as compared to feelings and sensitivity when choosing a medical glove. So instead of you directly make decisions, you choose the brand ABCD. So now you follow a very systematic ways. So start with the criteria itself, compare all the criteria. So from the criteria itself, later on, we are able to calculate which criteria carries the higher weightage on that particular decision. And then from there, we will go through the second series of the pairwise comparisons questionnaire, in which you compare the performance of different alternatives with respect to each of the criteria that we are having. So after you collect your data, or after you let the decisions makers to do the pairwise comparisons questions, then we move on to the calculation. So the calculations is all based on matrices. So the mathematics operations for AHP as well is based on matrices. So what we need to do is we will form pairwise comparisons matrix for each of the relationship that we are saving, we are investigating. So A is that the pairwise comparisons matrix. So depending on how many criteria as the example just now, so three criteria. So we know that the pairwise comparison matrix for the criteria with respect to the goals is 3 times 3 matrices. So we call them priority matrix as well. So X is the eigenvectors, that is what we call as a priority vectors. So in the end, that is what you want to calculate. It gives you the priority weights of each of the criteria of variables. And the lambda is the eigenvalue. So lambda helps us to calculate the consistency, help us to perform the consistency analysis, in which I will explain more on later. So each entries into the pairwise comparison matrix itself, they represent the dominant relationship of the criteria on your rows with respect to your column. So how a pairwise comparisons matrix looks like is something like the tables in the bottom here. So you can see J is referring to the item in the row, and then K is in the column, in which they are the same thing. So if we see, like if A and A, so they are going to equals to 1. So all the numbers, when they are referring to the same thing, column and the row, so they are equals to 1. And then this metric itself, they are reciprocals with one another. So in another way, so here, if you can see the values of here, they on our upper right, they are reciprocals value with our lower down here. Okay, so examples easiest for you to understand is like this one. So price and price, if we see here, then they are always equals to 1 because they are referring to the same thing. So if I compare price with resilience and strength, if you see the values itself is lesser than 1, that means the criteria in the column in resilience and strength is more important as compared to the criteria in the row, so the price. So if I compare price and feeling and sensitivity, if you look at this value, in which it is bigger than 1, that means price is more important as compared to feelings and sensitivity. So how do I say the values is reciprocal? If you look at here, the resilience and strength in your row as compared to your price. So this is 2. Basically, if I multiply here with the values here, they are going to equals to 1. So that is all these formulas is telling you. Okay. So if I multiply the AJK with AKJs, they must satisfy equals to 1. So if you look into your pairwise comparisons matrix and then you realize that multiply them is not equals to 1, that means something wrong is with your data. So you need to go back and revisit them. So this is examples of a pairwise comparisons matrix. So how do we calculate the priority weights? So after you have your matrix itself, so you can just go through these 2 methods. It's very simple mathematics as well. Method 1 is you normalize all the values in the priority matrix. It's column sum. So you sum up all the values. So you sum up all your column. Okay? And then you normalize them. So you divided the values itself with its sum value. And then you take the overall raw average. So that gives you your priority vector. Okay? The second method, you multiply the matrix itself. So you multiply this pairwise comparison matrix by itself. So, and then after you multiply them 3 or 4 times until the values they are stable, and then you sum out your raw value, and then you normalize your raw value. So both of them give you very similar answer. So depending on how many decimal points that you're taking, there might be slight variance in there. But both of these methods can be used. And then after you calculate your priority vectors, it's not to say I can use that particular weight already. So it is very important for us to do the consistency measurement. Why do we need to do consistency measurement? I'm not sure if you have experienced this before. For example, you are talking to your friends and then you ask them about the different selections of foods that is available out there. Ask them which one they are more preferred, and then they tell you A is more preferred to B, and then B is more preferred to C, and then they tell you C is more preferred to A. So if we slow down and think through this logically, so if I say A is more preferred to B, and B is more preferred to C, and C shouldn't be, A should be more preferred to C. Okay? But if you ask them to compare A to C, and then they tell you C is more preferred to A, in which we know that the consistency of their thought process might not be there. So we need to revisit and ask them to think through it properly, the relationship of the different variables that is out there, so that they can make a correct decision, so that this will not affect the final decisions that they make. So another examples on some of the issues that we see with consistency is sometimes we talk, then they will tell you like a different brand of cookies. For example, if I want to buy cookies, and then I tell you like brand A is more preferred to B twice, okay, and B is preferred to C 3 times. And then comparing A to C, and then he is telling you C is preferred to A only 5 times. So if we do the calculation, A is more preferred to C twice, B twice, and B prefers to C 3 times, then A more prefers to C by how many times? You should be able to calculate that. But usually when we just directly jump into C and A, then there might be issue with the consistency of our thought process, or when we give our judgment. So that is why we definitely need to run consistency analysis, because the pairwise judgments that the decisions maker provides to use to do the calculations, that is what we use to calculate the priority weights. So if whatever they give us is not consistent, that means the final priorities weights that we calculate is not accurate as well. So we need to make sure whatever that we attend, we do go through this process to calculate the consistency ratio. So the formulas of consistency ratios is given there. So it's really simple. We need to calculate consistency index and then divide it by random index. So I will not go so much into the calculation portion. So what we need to make sure we know when we use AHP is the consistency ratio, it needs to be less than 0.1. So it needs to be less than 0.1. Implies that the judgments from the domain is whoever who gives the judgment. In this method, we call them domain. So are consistent for that particular decision. So consistent for that particular decision. So what we need to calculate is the consistency index. For the random index, we can just get it from the tables. So because it already being calculated by Sotis and his team. So basically random index is the average of consistency index value of various size of comparison matrices. So the values of the random index, they can be obtained after following all this step. So how this random index, the values in which you see in the table here is attend is they basically generate consistency comparison matrices based on people's opinion as well as following the Sophie ratio scale. And then they evaluate the consistency index of different size of the comparison matrices. And then finally, they obtain the average values of the consistency index, which is what we call as a random index. So we just need to calculate the lambda value. Remember I said just now the eigenvalue. So we calculate the eigenvalues. We follow this step by step. Then it gives you your lambda value. And then once you attain your lambda value, you just plug it in into these formulas. Lambda divided by n. Again, n is the numbers of variables. So, and then divided by n equals to n minus 1. Okay? And then what we want to see is the consistency ratio. So you can see this one is our consistency indexes. And then 0.58 basically is random index you just get from this table because n equals to 3, so 0.58. So if you calculate the result itself, it's 0.01, so it's less than 10%. So we can use this set of data. So whatever judgments that the domain is given to you, we can says that is consistent for that particular decision, so we can proceed. We can proceed with the calculation. So that is the consistency analysis. So after you run through the consistency analysis, remember our hierarchy models just now consists of 3 levels. And what we are showing just now is only the levels 2 with respect to our level 1. We compare the criteria, wants to know which criteria is more important with respect to buying the medical glove. And what we need to do next in order to help us to attain the ranking for alternative, we need to continue to repeat the process, but using the levels 3 element, the different alternative with respect to our levels 2 criteria. So you calculate the eigenvectors of the alternative with respect to each criteria. And then we move on to multiply the criteria's eigenvectors with respect to the goal. And then it gives us our final priority weights and ranking. Okay? So this is the models that we show. So just now, this is what we do. So we compare price with resilience and strength, price with filling and sensitivities, and resilience and strength with filling and sensitivities. And then we calculate the priority weights. So these are the weights that coming out with based on. And then we doesn't stop here. So what we need to do next is we want to compare the 4 different alternatives with respect to the price. So with respect to the price, we want to know whether A, the price is better as compared to B. And then you compare A to C, and then compare A to D. Okay, so same for your resilience and strength, as well as the filling and sensitivity. So after that, you were attending 3 eigenvector, different eigenvector, your ABCD with respect to your price, and then your ABCD with respect to your resilience and strength, as well as your eigenvector, so this one, with respect to your filling and sensitivity. So you form this as priority matrix, and then you multiply with the criteria in which we calculate as well. So the weights of different criteria, how important they are with respect to choosing the medical glove. So you multiply them together, then it will give you your final ranking as well as final priority weights. Okay. I understand that for some of the criteria that we say we choose, for example, in this case, price. Price is something that actually we doesn't need to compare them because the price itself is a quantitative variables in which you already can attend the information. For example, in this case, ABCD, we already knows their price. Okay, so in this case, you doesn't need to go through the pairwise comparison to compare A to B, A to C, A to D, and then to go through the calculation and consistency analysis to get your priority vector. What you can do is you can directly normalize all this value, the data available. So there will be a priority vectors on its own. Okay, so for quantitative data, quantitative variables in which the data has already available, you can omit the pairwise comparisons stages and just normalize the value. What I mean by normalize is you just sum out all your row value, so you sum them up. So you're divided this particular value with the total sum that gives you 0.3. So that is normalization. That's how you do normalization. So these are quantitative data in which we can directly calculate, then we can. So for some of them in which we need to go like the resilience and strength, maybe the data is not available or people's the experience of the staff using them is important as well. We need to involve the qualitative component of them. Then we go to pairwise comparison judgment. We fill up our pairwise comparison matrix. So 4 alternatives. So this one is 4 times 4 matrix, and then you calculate them. So this is the priority vectors for resilience and strength, and this is the priority vectors for fillings and sensitivity. And then you just combine them together. So as you can see, the price is not from pairwise comparison, but that is okay. So you can use them. Okay, so just normalize them. That's fine. And then the other 2 is from pairwise comparison questions. Okay. And then we have the eigenvectors to form your priority matrix, multiply with the criteria weights that you have. And then what it gives you is your 4 alternatives. You can rank them, which one is more preferred. So in this case, you can see D is more preferred, 0.36. So if your percentage done, so 36%. So can choose D is more preferred as compared to the rest. And then if it doesn't want to go with D or D suddenly it doesn't want to apply, then we can move on to your second choice, A. How many? Yeah, so all these are the weights as well. So you get the ranking and you get the weight of each of the choices that you have made as well. So this is how EHP can help you to make decisions in which, regardless they are quantitative variables in which you already have data, you still can compare them with the qualitative. So you integrate them and then combine together to calculate our final decisions, the weights as well as the ranking. So in the event that the decision maker is more than 1 person, so usually in most of the cases, it's not only one people is making the decision, maybe it's the head of different departments, finance departments, they do take a part in that particular decision. So how do we aggregate all their inputs, their pairwise comparisons input is based on jaw mean. So how you do that is when each individual's, each response, you collect from your domain. So they have their own pairwise comparison matrices. But before you would derive the priority vectors, you use draw means to aggregate them first. You use draw means to average the values of multiples input, and then we continue with the calculation portion, direct priority weightage, and then the same thing you need to go through consistency analysis as well. Okay, so the reasons that we are using draw mean but not average is because judgment is not something in which we have a specific skills, like assures everyone are from the same background, have the same values, has the same experience in responding to the questions that we posted to them. That is why we use draw mean. So it will be more accurate in that sense to average the value instead of you just divided by how many responses that you get with the average means that we know. So that is why we use draw mean. So this is the first portion in which we touch about AHP, analytic hierarchy process. But I also understand that maybe in some of the situations in which the problems that you're having, or in a lot of the real life problems that you face, or in healthcare decisioning, it is not as simple as you can just structures them into a hierarchy, because maybe some of them are correlated to one another. Maybe some of them have influence on other factors as well, or some of them have feedback dependencies of other elements as well. So in that cases, that is where NMP can step in to help you to solve that particular problem. So analytic network process. So analytic network process, it is actually the generic form of AHP. Even though AHP, analytic hierarchy process, is introduced first before ANP, but actually ANP is the generic form of AHP, in which later on that you can see it's just what the capabilities or the value added for ANP is. It is more appropriate to a lot of the real life problems which involve a complex relation. Not only the qualitative and quantitative, you want to combine them, but between the variables itself, so they are affecting one another as well, or they are dependent on one another as well. So ANP enables us to take in considerations of feedback dependency as well, in which not only the criteria determines the dominance relationship of the alternative, but the other way around, in which the alternative, they might affect the criteria as well. So we take in considerations of this feedback dependency. And the other is what we call as inner dependency, in which maybe it's the criteria themselves, they are affecting one another. So when we say price, higher price, maybe the price itself does reflect on the resilience of the glove, or on the sensitivities. So maybe in the criteria levels itself, they might already have the dependencies of influence on other factors. That is how ANP can step in to help us to take in considerations of these two others' relationship, as compared to hierarchy process, in which top to bottom relationship only. Now we can look into the relationship readings, the levels itself, as well as the other way around, the feedback dependency. So it factors the futures into presence to determine what we need to do now to obtain a desired future. So if we want to achieve a particular goal in the future, and we want to predict the influence or impacts on particular actions that we take today, so we can use ANP tables to help us to do that. Okay. So the basic structures for ANP, so instead of it's a hierarchy, so it is influence of network. So with clusters, and each of the clusters, inside the cluster themselves, they can be a cluster on its own, or it can be have a nodes, have a subunits in the clusters itself, within the cluster as well. So the basic structures is different with EHP, in which is always hierarchy models hierarchy model. So it is represents in a network way rather than a hierarchy. That is where the naming of these two MCDA is coming from as well. So for AMP, in most of the situations, you will see different issues that using AMP. Usually they structures them either in a network models, in which the goals is in the middle, and then they have different clusters surrounded by the goal itself. Or you can, the same thing, you can structure them into a hierarchy way as well, but it's a hierarchy network model. Beside that, in a hierarchy top to bottom, but you also trying to investigate whatever relationship. So in the within the levels itself, so hierarchy network models. So for both of these models, how the calculation wise is the same. So this is how networks models looks like. Basically, you have your goals in the middle. You want to estimate the market shares of grocery stores, for examples. And then you can see there are different clusters around by the advertisement, locations, the characteristic of the stores, the merchandise, the alternative. So what we can see is all these clusters, they can affect on one another, and they can affect on the final market shares of the alternatives that you are actually looking into. So this is how a networks models looks like. And this is examples of a hierarchy network models, in which it's like a hierarchy. It starts with the goal itself. Maybe you want to choose a restaurant, eat your dinners, lunch. And then level 2 is your criteria. You look into the price, ambience, and services. But you see a loop over here, which is telling us we also want to see the inner relationship between these factors as well, whether price, does that affect ambience and services, or whether ambience affects price and services. So we have another levels of analysis we need to do. And the third levels are your alternative. Okay. And then if you can see, so here, there is a feedback dependency as well, whether they will affect the criteria or not. Okay. So these are a hierarchy network model. So the ANP step basically is the front part, the initial step are exactly same as AHP, but ANP, you have an additional 3 more steps in which you can see on the 5, 6, and 7. The same thing, what you need to do first is you develop your networks model. But usually if it's a network models, it take a longer time for you to develop it, because you need to understand all the different relationships and how do you position them so that it's less confusing for the decision makers to compare them. So we need to find the optimum way to structure your network models, because you can change them in any way, but we want to make sure that you find the way in which there is less overlap, so that will ease your calculation part later on and reduce the size of your supermatrix later on as well. So networks model development. And then same thing when it goes to pairwise comparison judgment. You derive parity weights as what explains in EHP just now, and then you run a consistency analysis. But after we calculate all the priority vectors, because LMP, so we take in considerations of more relationship. So in order to combine them to reach to our final weightage and ranking, so now we need the help of a supermatrix. So supermatrix was starting is basically a giant matrix, combine every single relationship, combine all the eigenvectors. Just now we only have priority matrix and criteria matrix in which you multiply them, you get your final ranking. But now you need to form your supermatrix, in which the first version in which you just plug in all your priority vectors for a different relationship into the supermatrix that is your unweighted matrix, unweighted supermatrix. And then from there, we normalize them and then make sure all the column becomes stochasticity. So that is what we call as weighted supermatrix. And then from there, we do the calculations until it reach limit matrix. That is when we can attain a final value. We call a limiting value. limiting values as our final result and ranking as well. So this is the examples just now on the restaurants that we choose. You can see there are different relationships here, whether we want to study them or not. So if there is if there is no relationship, you can put them zeros, that is fine. But each of them, they will have your 3 criteria with respect to your goal. They will have 1 priority vector, and then your fast food, casual dining, fine dining, with respect to each of them, they will have their priority vector as well. So all of them will inputs into this is the structures of the super matrix, but it is not only 3 times 3, it's just showing the relationship. So depending on how many variables that you have for the whole network models itself, that is the size of your super matrix. So these are all the different relationships that we can see and the illustrations. We will not go into any of them. So author dependency as what we observe, this one. The first one basically is what we call, is exactly same as the hierarchy model. So in A and P, they are outer dependency. So the arrow 3 in which you observe 4 and 5, the looping arrow. So those are inner relationship. So inner relationship, they can be independency or they can be independency. So different type of inner dependency. So the illustration is here as well. And then there is outer dependency, but it's a feedback dependency, which is the other way around. So instead of levels 2 with respect to level 1, but now levels 2 with respect to your levels 3. So it's the other way around. So this is how a super matrix looks like, the size of it. So if we have 3 elements in your levels 2 and 3 levels in your levels 3, with your goal itself, then your super matrix size will be 7 times 7. Okay. So if you have more different criteria, then the size increase based on the numbers of elements as well. So if we look into another example of a network model, so if we see these examples with the goal to improve the vaccination rate, and then in order for us to improve the vaccination rate, first what we will be seeing in these models is we first look into the factors. Maybe it is because of the accessibility, or it is because of the availabilities of the vaccine as well as the human resources, or it is due to the awareness of the public. So these are some of the factors that hinders the low vaccination rates in which we want to investigate. So you can form them as well. And then you can also add in like the mitigation strategies. What are the strategies in which you can implement, in which we can see on here, we have the governance and coordination, whether or not if we implement or improve better governance or coordinations for our vaccinations program, or we increase our vaccination centers, or add more resources, whether that will solve the problem of accessibility or availability. So you can see each of them have different relationship, and this is the network models. By looking at it, you might be confused, how are we going to derive the calculations and so on. But basically, each of the arrows, you can just draw them as such. So we can break them down from the goal itself, wants to improve the vaccination rate. First, we look into the different factors. And in here, what our priority vectors here will tell us is which factors needs to be tackled first to improve the vaccination rate. So the priority vectors in this will tell us like which one is the most important, which we need to tackle first. Okay. And then what can you see in that network is you can also try to investigate in order to improve or improve the availabilities of vaccine. So there are 5 different strategies out there. Which of these strategies will be more effective in managing the availabilities of vaccines to improve the vaccination rate? Okay. So you break down into here. And then the same thing, these 5, which of them will be more effective to manage the availabilities of human resource, okay, as well as the accessibility, as well as your awareness. So you can go through the same process. You ask the questions, and in each of these questions, the variables themselves, you just draw them with respect to the particulars goal in which you want to address. Okay, and these are the inner relationship we will be observed. For example, you want to know whether if we increase the availabilities of vaccines, does that have influence on availability of human resources, or will that enhance our accessibilities, or whether awareness? So these are the inner relationship you can see within the clusters itself, or different clusters. And these are what we call as a feedback dependency. So it's not only you want to rank which strategies are most effective in tackles our availabilities issue. We also want to know, like, if we improve the governance or coordinations of that particular program, whether that will have a reciprocal impacts on our factors, on the issues that we first see. Even though when we come up with our network models, we start with the goals to the factors and then to the strategies. But actually, you can look in the other way around by implementing particular strategy itself, whether it does affect other factors as well. So it's a feedback dependencies you can observe. So by coming up with this graph, you might be confusing how you want to, there are so many clusters, so many factors and strategies associated with that goal. So how to reach the decision itself. With the 8MP, you can break them down, and then through the systematic comparisons of the variables with respect to the higher levels in each of these one. And then with this one, with the priority weightage, you can form a supermatrix. And then when everything is captured in the supermatrix, from the unweighted supermatrix, we make them column stochasticity. So either you multiply with the cluster weights itself, or there is no cluster weight, each clusters carries the same importance or dominant relationship. You can just normalize them, so to make them a column stochasticity. And then from there, we multiply the matrix by itself. So we powers the matrix by itself until it's all the values converge to form limit matrix. So what the values converge is telling you is it captures all the possible movement of the elements in this model. So when in this supermatrix, we keep on powers the matrix until all the values converge. What it's telling you is all these inner relationship, outer dependency, feedback dependency is really captures in the value. So when the values is converged, that is the limiting values in which you can take. And tells your stakeholders, so following this step of AMP, so we reach to our final outcome, in which like we have 5 strategies we coming up with, and then you just show them which is more effective in dealing with different problems, that in dealing with the 4 factors that we see just now, to help us to achieve our goal, which in that example is to improve the vaccination rate. So that is how AMP works. So very similar. So actually, if you look down as how we break down the network process into all these relationships, they are AHP as well. So it's just like AMP. We have an additional step in which we aggregate all the values or the relationship into a supermatrix. And then by converging the values of the supermatrix, that give us our final outcome. So taking considerations all the inners and all the relationship associated with that. So I think that is all for the presentation. I will open up for Q&A. I'll pass back the time.
Thank you so much, Dr. Ngan. We have 3 questions here.
Yes.
So do you like me to give you all the 3 questions or just one by one?
I think one by one.
Okay, one will
Yep.
be okay, right?
Yep.
So, okay, the first one, the questions. In the example, why more expensive alternative have more priority weight?
Why more expensive? Come again, the question.
Why more expensive alternative
Mhm.
have more priority weight?
Okay. So yeah. So if we look into the examples itself, that again that depends on because when we make the decisions based on the glove examples, I assuming that he or she is referring to that
Yeah,
example.
one of the slides.
Yeah. Yeah. So what we can see is actually there are criteria weights as well. So from the criteria, so if you can see the models itself, so they are criteria as well. So we calculate the criteria first. So before we jump into directly compare them based on the price, we actually compare the criteria themselves, which one is more important when we choose a medical glove itself. So even though the price itself, even though it is more expensive, but maybe the price does carry lesser weight as compared to others in our criteria level. So when we multiply them, so our decisions that we finally make, so is what not only based on one criteria, but based on the combinations of these three criteria. So if based on these examples, this is the criteria that we calculate. You can see the weight itself only carries 32% on your decisions. And then 56 is the resilience and strength. And 12% is feeling and sensitivity, but based on this example. So even though the price is most expensive, but if you thinking back, and then because the price itself doesn't carry the higher weight in that particular decision, maybe the expensive one, they have a very good performance in the resilience and strength, in which if I look at the criteria itself, I can link them together, or that is why, even though it is expensive, but because what criteria that we looking into the most when we choose as resilience and strength, that is why our final decision, it will still tell you that. So it's based on this one.
Yeah, it actually there is other factors that involve, you know, when making a decision. Beside the price, we have resilience and strength, and also feeling and sensitivity. Okay, all right. So the second question will be, can we incorporate MCDA with cost benefit analysis or CBA?
Yes, I would say, yeah, sometimes, yes, you can do that. So it's either when you do your cost analysis, either you already come up with your cost analysis, and your cost is one of the classes or one of the criteria in your AHP and ADMP. So you run your cost analysis first, and the outcome itself, you generate it as one of the variables in your models, and then you combine with other factors that you look into. And then it helps you to derive your final ranking of priority weights as well. So you can do that.
Yeah, okay. The final question will be, can MCDA be integrated with SWOT analysis? Is it can be integrated with MCDA?
There are studies, they do use MCDAs with SWOT analysis as well. I will say looking at which perspective that you want, because when you perform SWOT analysis, it's more like what the outcome it gives you is more qualitative. So it's tell you what are the strengths, what are the weaknesses.
Yeah.
So you can do that, but with all the strengths and weaknesses, after you run your SWOT analysis, you pack it in to develop your MCD's model, and then from the qualitative outcome itself. So now, after you go through the pairwise comparisons, comparing different strengths with different threat opportunities and so on, and then in the end, it will give you a value, in which a lot of time in reporting to stakeholders, when you have the values itself, it's much more easier to compare why do we make that particular decision. So yeah, there are some studies that I observed they are combining these two methods as well. Yep.
I think we just have three questions here. Okay. Yeah, we're gonna stop. Again, thank you so much to Dr. Ngan Suling, for your time to share your knowledge on application of multiple criteria decision analysis, or MCDA, in health system decision making. Thank you so much. It's very fruitful. I would love to see you again. Maybe like we must have like one workshop, particularly with you, regarding on the MCDA. And to all the viewers, thank you so much for participating this afternoon CME, and hope to see you again. Stay safe wherever you are. Thank you and goodbye. See you.
And thank you. Thank you, everyone.
Okay, Doctor. Thank you so much.
Okay.